Gentleman from Arizona, Mr. Shadegg.
Thank you, Mr. Chairman, and thank you. I want to also thank you for holding this hearing so quickly on this important topic. I believe I've mentioned to this committee before that my oldest sister is a 20-year breast cancer survivor, so I have a keen interest in this topic. The breast cancer treatment guidelines released on November 16th by the U.S. Preventive Services Task Force have created a firestorm across the country, giving rise to concerns about women's access to life-saving screening. Some have commented that these recommendations are merely guidelines for insurance companies and government officials trying to assess the relative value of mammography, clinical breast exams, and breast self-exams. In a written statement, Health and Human Services Secretary Kathleen Sebelius said the guidelines had caused a great deal of confusion and worry among women and their families across this country, and stressed that they were issued by, quote, an outside independent panel of doctors and scientists who do not set federal policy and don't determine what services are covered by the federal government. I am here to tell you today and to tell every woman in America that under this bill, H.R. 3962, which has already passed this Congress, that statement will not be true. Indeed, under this bill, the recommendation of this task force would become binding law. And if so, it would be devastating to access to mammograms and nothing short of catastrophic for women's health in this country. In their recent report, mammograms for women aged 40 to 49 were given a grade of C. Under this bill, any procedure given a grade of less than A or B cannot be covered by the public plan. So the women that my colleague worried about who have no access to care today for mammograms could not legally get mammograms once this bill becomes law. The panel also found insufficient evidence to determine whether it's worth screening women over the age of 74. Again, because the grade was neither an A nor a B, it was an I, insufficient. Under this bill, those women could not get mammogram screening legally under any public plan. But it's important to understand precisely how far this bill goes, because it does not just prohibit mammogram screening. If this were the finding of this same task force after H.R. 3962 becomes law, it would prohibit private insurers, make it illegal for private insurers to provide mammogram coverage to women in these age groups. That's what the law says. Let me explain. Under the House bill, private insurers can offer 4 health plans. 1, a basic plan. 2, an enhanced plan. 3, a premium plan. And 4, a premium plus plan. Under Section 303 of H.R. 3962, women purchasing insurance under the first 3 categories, basic, enhanced, or premium, would not be allowed to purchase because the insurance company would not be allowed to offer a policy covering mammogram services. That's right, it would be illegal for a private insurance company in any one of those first 3 categories, basic, enhanced, or premium, to offer coverage for mammograms because mammograms were not given either an A or a B rating. With regard to the top category, Premium Plus, an insurance company could offer coverage for mammograms, but if and only if the Health Choices Commissioner specifically allowed the policy to cover mammograms. Now, I don't suspect that many of my colleagues on the other side of the aisle understand that aspect of this bill, and I hope that before this bill or anything like it were to become law, they would study it closely and recognize what is wrong with it. Certainly having the government prohibit people who choose to be able to buy mammogram coverage is not what was intended by the authors of this legislation. But in fact, that's what the bill does. The government would prohibit millions of women from buying coverage for mammograms. The government would forbid private plans from offering mammogram coverage to millions of women. Poor and middle-class Americans, by force of law, would be prohibited from getting mammogram coverage under the insurance exchange
Gentleman is 2 minutes over. I've let
created
it go
in this
on.
bill. I thank
Like
the gentleman for his indulgence and hadn't realized I'd gone over time. Thank you.